catheter life. Patients by whom operation is refused or to whom operation seems unsuited may employ the catheter. Before this is agreed to, cystoscopy should be performed so that one may be conversant with the conditions inside the bladder as to diverticulum and stone, as well as size and shape of the prostate itself. The ancient rules as to the frequency with which the catheter should be passed are never followed by the patient. If the amount of residual urine is small and the bladder irritability slight, the patient will refuse to pass his catheter more than once or twice a day. But as a rule, he promptly goes into chronic complete retention and then should be urged to pass the catheter often enough to forestall urination. The traditional 3 times in the 24 hours are usually not sufficient. From 4 to 6 times are better. The patient might add many years to his life by being aseptic and gentle, but the average man cannot be bribed into either virtue by the promise of longevity. He totally neglects asepsis and uses his catheter like the ramrod of a gun. Some urethrae will withstand a marvelous amount of such rough treatment, but the majority will not, and their owners die miserably. The patient should be instructed always to keep the head of his penis clean and to wash his own hands well before touching the catheter. He should use a rubber catheter if possible, keeping a number of these in stock so that they may be all boiled together and laid between the folds of a sterile towel to be carried about and used when necessary, one by one. In order to catheterize himself, the patient washes his hands, takes his tube of sterile lubricant, anoints with it the end of his catheter, mops the lubricant from the catheter to the end of the penis, holding the catheter at a point at least 2 inches from its extremity and never touching those terminal 2 inches. He passes the catheter slowly into the bladder up to the point where it just draws water, holds it there until the bladder is empty, then withdraws it. Once a day, he irrigates his bladder with 1 to 4,000 solution of silver nitrate, using for this purpose a douche bag and filling the bladder to the point of comfort 2 or 3 times. It is preferable that the patient wash his bladder every day, for if any exception is made, he will probably stop washing altogether. After the first acute renal infection has gone by, if he is faithful and gentle with his catheter and irrigation, I see no advantage in the administration of hexamethylenamine. Indeed, the patient himself will soon desist from its use if it is advised. Exceptionally, however, the hexamethylenamine keeps the patient clean better than the bladder wash. The patient who has to use a woven catheter certainly ought to be operated upon, or else have a trained nurse constantly at hand to pass the catheter. Otherwise, he will simply punch holes in his urethra and cause both himself and his physician untold trouble.